fairly simple cure.
I'm the most curious in our family. All my family are physicians. All my brothers are also anesthesiologists. They're all specialists.
His newest challenge presented itself at the doorstep of his pain clinic.
These are patients usually rejected or abandoned by every single physician because they can't do much anything for them. They may see 8, 9, sometimes 10 physicians before they come to see me.
我们来到这个非常棒的地方啊，在美国这个地方，那也很荣幸的，大家能够收看我们的节目《詹哥谈话》。那很荣幸的，我这次拜访，老远到这个 USY 来见于医生。对，那今天也代表台湾的这些粉丝啊，还有这些一些观众朋友，他们很想了解到一些问题。那第一个，我想问于医生这个问题呢，可能大家都想了解，因为糖尿病的问题，也在全球，在台湾也是算是很大的一个疾病问题。现在发现到整个国民，大家在饮食上面都产生很大问题。那想问一下于医生哈。为何我们在糖尿病跟肥胖之间它是有什么关系？那您能够跟我们解释一下
？Okay, I'll frame it in English. So why does people who suffer from diabetes gain weight? Or what is the relationship between diabetes and weight gain? So I'll try to explain that in a more simplified form.
Yeah.
So when we eat, when anybody eats, glucose goes up. Okay, when glucose goes up, our body releases insulin, and when insulin reacts to the cellular receptor site, receptor site will opens up and glucose will go into the cell.
Yeah.
Okay, and we use the glucose within the cell to use it for metabolic purpose.
Okay.
And when we cannot finish using it, what's left over, we convert it into triglyceride and glycogen. Okay. I won't go into glycogen, that's very straightforward. But I want to go into triglyceride when this is where you gain weight.
Yes.
Okay. Normally, when you go into semi-starvation mode, meaning when you haven't eaten for 5 to 6 hours, glucose level drops. We tend to bring the triglyceride out from the cell and convert it into fatty acid and glucose to maintain a relatively high glucose level so that we can continue to function. Okay. And that's the normal process. When a person suffers diabetes, the insulin receptor site become insensitive to insulin. So instead of one or two insulin, you have 4 or 5 insulin molecules before cell wall will opens up, before the glucose will goes in. Okay, so that's the problem with that. So you need a high number of glucose. No, excuse me, a high number of insulin to drive the glucose into the cell. That's okay normally, but unfortunately now, with higher level of insulin in the blood, our body cannot bring the triglyceride out of the cell to convert it into glucose. So when your glucose level drops, instead of bringing the fatty acid out, we just feel hungry and we eat again. Okay. Now when we eat, glucose goes up, insulin comes in, drive the glucose in. So there's one way of glucose going into the cell and become triglyceride and fatty acid, but nothing comes out. Okay, so guess what? The cell get bigger.
So the people
bigger, they get
所以人就变
胖了，胖一点，慢慢胖了。So the process is ongoing, and when they get very, how do I say, insulin resistance get very high, then the person get pound much faster, get fat much faster, and they have lots of glycogen and lots of fatty acid
Yeah.
in the form of
Yeah.
triglyceride in the cell.
Yeah.
So the patient look like they slowly gain weight like that.
So the 糖尿病很容易变成肥胖。
肥胖, yeah. And one of the problem is people say that, well, I just don't want to eat so
Yeah.
much, okay? And then I will not gain some weight. But unfortunately, because the glucose level dropped very fast from the insulin, and there's no glucose coming out,
OK，
and the person's hungry all the time, always hungry, until finally you eat something. And when he eats, he want to eat sweet stuff.
OK，got it。
Okay.